afternoon, everyone. Thank you for joining us today for the NeedyMeds Brief, Safe Needle Disposal, States with Disposal Programs. This actually is the third in a series of 4 webinars about safe needle disposal. And today's webinar is going to focus on examples of disposal programs and options for disposal if your area doesn't currently have a program. In case you've missed the 2 prior safe needle disposal webinars, you can certainly shoot me an email. My contact information will be at the end, or you can visit the NeedyMeds YouTube channel. Before we get started with today's program, let me, of course, introduce myself. My name is Carla, and I am the NeedyMeds Education Coordinator. And before I introduce today's panelists, I want to go over a few tips to make sure everyone knows about NeedyMeds and the resources we offer, and what to do if you have any questions. So you can certainly feel free to type any questions you may have into the questions section of your GoToWebinar control panel. If we don't get the chance to answer your question today, we will certainly follow up with you via email, or you can check out our Safe Needle Disposal website or shoot an email to Safe Needle Disposal. Again, that contact information will be at the end of the webinar. Of course, I will provide everybody who's participating today with a copy of today's PowerPoint presentation. So let's get started. Before I pass the mic and screen over to our guest today, I want to make sure everybody's familiar with NeedyMeds. And there's a shot of our current homepage. And I always put that up because really our homepage is the face of our organization. NeedyMeds is a national nonprofit organization, and we are dedicated to educating and empowering those seeking affordable health care. And when we talk about education, we define that in 2 ways. The first way we define it is to educate people about NeedyMeds and the resources we offer. And the second is to spread the word about other valuable resources, which is what brings us to our webinar guest today. Safe needle disposal is a public health and safety issue that is commonly overlooked. Our panelist, Leah Zarillos, the Safe Needle Disposal Project Manager, is going to showcase some sites offer some of the most robust safe needle disposal programs, and give you some tips on what to do if your state does not yet offer any programs. So without further ado, I'm going to pass the screen and the mic to Leah. So please bear with us for a couple of moments while we make the transition, and you'll hear a moment of silence. Thanks, everybody, and enjoy today's presentation.
Thank you, Carla, for having me as your guest presenter today. I hope you'll find this website to be a useful resource and something you can recommend to others, family, friends, neighbors, patients, or whomever you know who would benefit. I would like to begin by briefly explaining who we are and what we do. Safe Needle Disposal is an information source for community-sponsored disposal programs for used medical sharps generated by patients at home. We also provide information on state and local guidelines. Most states have published their own guidelines and literature on safe sharps disposal. And our website is safeneedledisposal.org. And we are a resource primarily for consumers with home-generated sharps. Businesses, pharmacies, and healthcare facilities are regulated by state medical waste disposal laws. And the community disposal locations and state guidelines that we list are not for businesses because they need to follow different procedures based on the type of facility and where they're located. So the central feature of the Safe Needle Disposal website is our listings of disposal programs and locations. We have over 3,300 listings to date. And this is a list of disposal programs that are found in many of the states that have an extensive network of collections for used sharps. The most common are the top two listed there. 24-hour drop boxes, and those are kiosks that allow you to dispose a biohazard or other approved container by depositing it through a slot similar to a mailbox. And the other one is supervised collections, supervised drop-off collection programs. And that simply means you bring your container to a designated location and someone takes it from you. So just to name a few examples, healthcare facilities like hospitals and doctors' offices, health departments, and public safety offices like police and fire stations. And some areas have household hazardous waste facilities and special one-day collection events that accept used home-generated needles. Be aware that home-generated needles, it depends on who it is and what items that they're licensed to take. Container exchange programs, they're common at hospitals, health departments, and pharmacies. It typically involves going to the location to obtain an approved specified container and then bringing it home and filling it to, when it says it's reached the full line. And when it's full, returning it to the location for collection and later disposal. Many of these kinds of exchange programs only allow the use of the container that they provide in order to prevent people from bringing needles in unsafe containers. And the last one, needle clipper programs. These are pretty few and far between at this point. This is a type of program I've found only recently that some places have started doing, mainly health departments. I think this could be a type of program that will grow in time in place of people using sharps containers, especially people who are diabetic. And so the programs, as I said, they're mainly at health departments, the ones that I've found. And typically, they provide residents with these clipper devices, either for free or for a small fee. And the device is capable of storing over 1,000 needles. And when it's full, it can be either returned to the collection site or, if allowed, disposed of in the regular household trash. So for today, I want to highlight a few of the states that have a large network of collection programs. So in California, it's against the law in the state to dispose of used needles in the trash. Interestingly enough, it's one of only 4 states in the country which have a complete ban like that. We have found over 600 drop-off programs in that state. Many of them are at transfer stations, hazardous waste facilities, and there's also a extensive number of one-day collection events in that state as well. Many counties have them. The other one I wanted to mention was Florida. Programs exist in almost every county in that state. Residents can dispose of their needles at clinics, health department offices, hospitals, fire stations, and also some transfer stations and pharmacies. The facilities vary by the area and the individual counties, and they typically have their own kind of set of requirements, but the programs are readily available in that state. And the last one I wanted to highlight was New York State. In New York, all hospitals and nursing homes are mandated by law to accept home-generated sharps as a free community service. The only exception to the law is federal facilities, So for example, something like a VA, but otherwise any other hospital or nursing home is under that requirement. And kind of again, the individual facility may set their own policies and preferences. So it's always a good idea to check ahead before you go. There may be certain days or times or a specific department or location in the building that you need to visit. And so as you can see on the slide, I've provided links to the state pages so you can view the listings of programs as well as contact information for the regulating state agencies. So as of now, with the Safe Needle Disposal Project here at NeedyMeds, we've found programs in 35 states. It's really a large range. Often only certain counties or areas, sometimes even individual cities have programs, but there are still whole states out there where we still haven't found anything. So with that being said, since it's so broad, most of the country still doesn't have community disposal programs or locations. So what to do if your state or county doesn't have a program or you haven't found one using our website, what you'll need to do is follow the FDA guidelines or specific guidelines for your city or county. Definitely a good place to start would be to contact your health department to confirm if there are any written guidelines or procedures. Otherwise, if they don't really give you a good answer, or they in fact may not know, definitely contact us. We have a toll-free helpline and an email, which we will list at the end of the presentation. But all of our representatives, can help, and we can tell you what's allowed in your area. And if you're interested in starting a program in your community, contact your local Board of Health or health department. They can provide information on licensing and any special permitting involved to start up a program where you are. And if you're feeling very ambitious about trying to get a statewide program in place, contact your state legislatures and bring it to their attention that there's a need for it where you are. So that concludes the overview of collection programs and examples of states with large numbers of disposal programs. Thank you for listening, and please email us with any questions about this presentation or needle disposal in general. And so I'll pass the mic back to Carla for some announcements on upcoming webinars.
Thanks, everybody, for joining us, and especially a big thank you to Leah for today's presentation. I get the pleasure of working with Leah, and sometimes it's easy to forget how in-depth her knowledge is, and certainly how in-depth the Safe Needle Disposal website is. As evidenced by her giving you an update about, and hopefully I'll get this right, Leah, it's the Clipper programs. That is a recent, something Leah recently found out, and it gives you a sense of how important it is to stay up to date on such issues and check out our Safe Needle Disposal regularly to stay up to date with what's changing. As Leah mentioned, of course, I'll be emailing everybody a copy of the PowerPoint presentation, and in there I'll include an email. In the email, I'll include a link to the Safe Needle Disposal website as well, in case you have trouble finding that. As Leah also mentioned, before we wrap up, one second, what I wanted to do is bring to your attention a few other upcoming webinars that you may be interested in. For the first time, we are actually hosting a Facebook Live event this Friday, the 14th at 11 o'clock Eastern Time. So please join us, log into Facebook so you can hear or ask questions because our president will be conducting a Q&A. We also have a couple of upcoming webinars later in the month, one focused on SHINE or SHIP programs for Medicare beneficiaries, And we actually just recently partnered with this great cancer support group called Pearl Point Cancer Support, which provides just that, cancer support to patients across the country. And finally, please be on the lookout or register now for the final Safe Needle Disposal webinar, which is coming up in September. And you can register for all of these webinars on our website. You can find our calendar of events on the bottom right-hand page, which will take you to hyperlinks for registration. Or you can check out the Advocates tab under webinars. I also, as both Leah and I promised, there's our contact information for Safe Needle Disposal. You can give them a call, or you can shoot an email to them. I also went ahead and put our colleague Alana's email address up there in case you're interested in learning more about NeedyMeds or receiving some of our drug discount cards or brochures. And I'll remind everybody, if you are interested in learning more about NeedyMeds, you can certainly attend one of our monthly overview webinars. We actually have one scheduled next Wednesday evening at 7 o'clock. So hopefully you can join us for that. As promised, I'm just going to leave you with our contact information right here on the screen. We do look forward to keeping in touch. Thanks again for joining us, and have a wonderful afternoon.